So we have our very first conference. We did kind of had a unique format, and we did working groups. And out of that, these working groups came from Dr. Iyer. This is Dr. Iyer right here in the front. Would you stand up? Thank you. Dr. Iyer has been a wonderful support and has spent hours and hours helping with our nursing advisory board. And this came out of her group, which was an idea for the biliary emergency information card. If you have not been to the website and you don't know what that is, please go there. There's a risk for our patients, those who have stents and tubes, but also it can happen with patients who don't have that. And it's called ascending cholangitis, can be deadly for them. And we wanted to give them a way. Oftentimes these patients, when there's an emergent situation, are seen in an emergency room and not by these physicians, and we wanted to give them a way to communicate what's happening. And so that's what this card did for them. We then partnered with Boston Scientific, and they have created an app for the patients, caregivers, and for the physicians. And this will allow the patients to get immediate attention if there are problems. This is a kind of a pilot program for them. This is the kind of the first patient app of this kind they've ever done. And so they are meeting with patients, they're meeting with physicians, they need your input. And so I'm gonna turn over to Mark and Nikki.
All right. Good morning, everyone. So my name is Mark Cirillo. I work on our mobile development team at Boston Scientific, and I'm joined here with Nikki.
I'm Nikki Fonseth. I'm the visual designer, and I'm also the designer on the app.
So this will be a little bit of a repeat for the patients who were here yesterday, but I just want to thank them for all their feedback and their enthusiasm. It's really great to meet with all of them and get that enthusiasm and see the enthusiasm for this app that we're creating. So like Stacy said, we're in a prototype phase. We have been meeting with patients, Dr. Iyer, and several others to get feedback on what we want this app to do. So the whole concept here is really a single app for all the patient needs, and even for the caregiver and doctor needs as well. So we want to provide the following information at their fingertips because, as you know, the internet is filled with tons of information, some of it good, some of it not so good, some of it can be misleading. So with what we've heard from patients, it can be overwhelming when they first find out that they have cholangiocarcinoma. We want to provide them with a one-stop shop where all their information is located. So the first thing, and what we've kind of seen the most enthusiasm about, is the latest research and news. So anything related to cholangiocarcinoma, we want that to show up in the app in real, as soon as possible, so they don't have to, again, scour the internet looking for that information. The next piece here is information about their condition, their stent, and their care team info. So if they have a stent placed or a tube placed, they can add that information. If they have it removed, they can edit it and have it removed. I'll show you that when we go through the demo. Information about their condition as well as their care team. So if they wanted to add a caregiver or their oncologist or gastroenterologist, they can add that information very easily and have that one click away. And finally, providing key information to their doctor in an emergency. So one of the things we've heard, the purpose of the emergency card, if you're in an emergency room and this doctor you're seeing doesn't know what cholangiocarcinoma is or isn't familiar with how to treat you, we want that information available right there in the application. So how did we get here? So a few months back, we started talking with the foundation. We started kind of from scratch. We didn't know what cholangiocarcinoma was. We didn't really know how to pronounce it, and it was something very new to us. So what we wanted to do first was understand what it is and what are these patients going through. So then the next thing we did was talk to patients, talk to Dr. Iyer, talk to the patients. Some of them were here yesterday, and talk to Donna and Stacy and just really understand what is it that they want to see in this application. What is most helpful for them? What information do they want at their fingertips? And so what we've done now and what we're going to show you here in a minute is really kind of we created this overall app experience and design. And really kind of what we want to do now and what we've been doing yesterday and we want to do today is gather as much feedback as possible and then go on and develop this and launch this to as many users as possible. So again, please provide your feedback. We're open to any feedback at all. So please stop by. We'll be in the back if you want to come talk to us. So I'm going to walk through some of the screens here just to kind of give you an idea of what this app looks like and what it does. So the first screen here is the load screen. You see the Cholangiocarcinoma Foundation app with Boston Scientific on there. This is a partnership. And then the first thing you'll see is, what is this app all about? What does it do? And it's all about the two things highlighted: communication and staying up to date. So communicating with your caregivers, with your family, your friends, as well as staying up to date on the latest research. So the next two screens are all about terms and conditions, agreements, as well as data privacy. So we understand that this information is, it's patient-specific and sensitive information. So we want to make sure that they understand that who this data is being shared with, where it's being collected, and what we're doing with that information. So we make that clear here. And then also kind of we advise them to put a passcode on their phone to protect this information. We want to make sure that they understand they are providing this, it's their responsibility. On our end, we are securing that information, but when it's on their device, we want them to make sure that's secure. So once they get started, this is the screen they'll see. It's blank. They can edit their name, their icon, their medical condition, stent or tube information, and their patient care team. So when they click on edit, they'll see this screen. They can add their condition and edit really anything on this screen. So the first thing, a little bit lighter touch. We wanted the ability, we kind of kept with the cholangiocarcinoma logo theme here, and wanted to allow them to add their own tree. So not necessarily kind of have to take a picture of yourself or upload a picture, but really kind of just personalize it with your own touch and put your tree there to put your own touch on it. So the next thing, when they go to add their stent, it's going to ask them what kind of stent they want to add. And then it's going to ask what date that stent was placed on. So once they enter that information, they can then add someone from their care team. So depending on whether caregiver, physician, hospital, oncologist, they can select what type of caregiver. And if they have them in their contacts already, they can add them right from their contact screen, or they can add a new contact as well. So this is what the screen looks like. You'll notice that they do have the ability to add multiple stents. If they go to remove a stent, it's not going to completely wipe it out. It's just going to show the date that it was removed. And then the patient care team, they can add as many as they want there as well. So once they're done, this is the screen that they'll see. You'll notice that they have the two phone icons next to their contacts. With a click of a button, they can call those contacts as they need to. So this latest research screen, they have the ability here so this will be similar to a news feed or your Facebook feed, where it's going to show the newest information on top. And we want to, clinical trials, press releases, any news related, we're working on how can we aggregate the best content and have this update and push notifications to patients when there's new information out there. So again, they don't have to scour the internet for it. The next screen here, the next tab is for the doctor. So again, if they are meeting with a physician who's not familiar with cholangiocarcinoma, and it's a non-emergency situation, they can provide them with some very basic information on what is cholangiocarcinoma, who are their resources that they can reach out to for more information, and just helpful information for them in a non-emergency situation. In an emergency situation, you'll notice there's two tabs here. So there's the for the patient and for the doctor. So for the patient, which is not shown here, is all about if you have certain symptoms, please go see. It kind of guides them on what symptoms to look out for and when to go seek help. And then finally, what I'm showing here is for the doctor. So for the doctor, if they are in an emergency situation, at the click of a button, again, they can hand this to the physician, or their caregiver can hand it to the physician and explain to them, these are their symptoms, this is how you should treat them. And there's the link to the biliary card information, which is a little bit more in depth as well. So again, we wanted to provide all this information to the patients. Very simple. We don't want to overwhelm them with information, but really keep things simple and easy for them to use. So that's what we have now. Like I said, we've got a demo in the back, and I'm going to pass it off to Nikki, who's going to talk a little bit more about what we're going to be doing later on today.
Great. First of all, I'd like to thank all the patients and caregivers who gave feedback yesterday. It was great to hear. We took lots of notes, and we've spent a little bit of time last night brainstorming about some of the improvements that we can make to the app. Like Mark said, it's still in prototype phase. So we'd love to get more feedback again today. So we'll be out in the lobby for a little bit. And then from 10 to 11 today, we'll be in the Bonneville room. And we'd love to, as many people who can stop in, we'd love to do a little bit of a brainstorm, some feedback, just to hear how we can improve it even more. Once we get back, to work tomorrow, we plan to, hit the ground running with all of this feedback and really improve the app. It's your app. This is really a great start for Boston Scientific to create more patient apps. So this is a great start, and you're all involved. So thank you very much.